Coronary angioplasty is a procedure used to open clogged coronary arteries. This procedure can improve symptoms of blocked arteries such as chest pain and shortness of breath. Hello everyone, welcome back to yet another episode of Med-Surg Mentor. If you are new to this channel, please subscribe and don't forget to click the bell icon to get the new video updates. Alright, let's start. Coronary angioplasty is a procedure used to open narrowed or blocked blood vessels that supply blood to the heart by applying pressure of an inflating balloon to clear the plaque. The major indication for coronary angioplasty is coronary artery disease, and coronary angioplasty is often used when there is less severe narrowing or blockage in the arteries and when the blockage can be reached during the procedure. Angioplasty is also done for narrowing associated with peripheral arterial disease. Pre-procedural cares of coronary angioplasty are: remove any jewelry or other objects that may interfere with the procedure. Ensure nil per oral from after midnight the evening before. Advise to wear dentures or hearing aids during procedure to ensure communication. Advise client to empty bladder before procedure. Get an informed consent. Change patient to hospital gown. Shave and clean the skin area using disinfectant solution. Secure intravenous lines. Check the pre-procedural vital signs. Get history of allergies. And attach ECG electrodes and pulse oximeter. Common sites of cardiac catheterization in angioplasty are radial artery in wrist and femoral artery in the groin. In short, this is the procedure of coronary angioplasty. After visualizing the blockage in the arteries, the balloon is inflated to widen the blocked arteries. Then a stent is placed and the balloon is deflated and taken out. Now let's see the procedure of angioplasty in detail. After doing the skin preparation, local anesthesia is administered. Then a sheath or introducer, which is a plastic tube through which the catheter will be threaded into the blood vessel, is introduced, and this will be advanced into the heart. The catheter will be threaded through the sheath into the blood vessel. The doctor will advance the catheter through the aorta into the heart. Fluoroscopy will be used to help see the catheter advance through the heart. Once the catheter is in place, X-ray pictures will be taken using a special dye that will be injected through the catheter to identify the narrowed sections or blockages in the arteries of the heart. The balloon is inflated for a short period of time to push the plaque back against the wall of the artery, and the stent is implanted. Once the balloon has been deflated and removed, the stent stays in place permanently, holding the blood vessels open and improving the blood flow. Post-procedure cares of angioplasty are: check vital signs and electrocardiogram. Monitor the insertion site and circulatory changes. Ensure bed rest. Watch for complications. Encourage to drink fluids to help flush the dye out of kidneys. In some cases, sheath or introducer may be left at the insertion site. If so, bed rest will last until the sheath is removed. After the sheath is removed, light meal is given. Make sure to not bend the affected arm or leg and administer pain medications. After cares of coronary angioplasty are: monitor the insertion site for bleeding, unusual pain, swelling, abnormal discoloration or temperature changes. Keep the insertion site clean and dry. Do not participate in any strenuous activities. Quit smoking. Take measures to lower cholesterol levels. Eat a healthy diet that is low in saturated fat. Maintain a healthy weight. Control other conditions such as diabetes and high blood pressure. Get regular exercise. And take medications as prescribed by the doctor like antiplatelet aggregators. There are some risks for the procedure angioplasty, and they are bleeding at the catheter site, blood clot or damage at the blood vessel from the catheter, infection at the catheter insertion site, abnormal heart rhythm, heart attack, stroke, chest pain or discomfort, allergic reaction to the contrast dye used, kidney damage from the contrast dye, and rupture of the coronary artery. Immediate complications that can arise after coronary angioplasty are fever or chills, increased pain, redness, swelling, bleeding or other drainages from the insertion site, coolness, numbness or tingling or other changes in the affected arm or leg, chest pain or pressure, nausea, vomiting, profuse sweating, dizziness or fainting. Nursing diagnosis for a patient who had undergone angioplasty are acute pain related to the surgical procedure, fear and anxiety regarding the invasive procedure, knowledge deficit regarding disease condition and the treatment options, hypothermia related to the reaction to the radio-opaque contrast, ineffective peripheral perfusion related to clot formation at the puncture site, imbalanced nutritional status less than body requirement related to dietary restrictions, risk for injury related to altered hemostasis and trauma, and risk for bleeding related to potential hemorrhage from the catheter insertion site. Nursing cares for patients who had undergone angioplasty are monitor vital signs and ECG, keep pressure dressing on the catheterization site, and assess every 30 minutes for bleeding, maintain bed rest for 6 hours post-catheterization as ordered, assess affected extremity, color, temperature and capillary refill, palpate distal pulses and use Doppler assessment to find pulses, monitor and record intake and output hourly, avoid flexion of hip or elbow more than 30 degrees, ensure hydration and resume to normal activity slowly, and watch for complications and administer drugs. Today we have seen regarding the procedure coronary angioplasty. Coronary angioplasty is a procedure used to open clogged coronary arteries. This procedure can improve symptoms of blocked arteries such as chest pain and shortness of breath. Common sites of catheterization are radial artery and femoral artery. We have also seen the pre-procedure care, procedure, aftercare, risk, complications, nursing diagnosis and nursing care. Hope this video was informative. If you like this video, give a thumbs up, share with your friends and make sure to subscribe to my channel. And guys, don't forget to click the bell icon to get the new video updates. Thanks for watching and see you next time.